Hi guys, today we'll be talking about renal filtration and clearance. But before we get there, we'll first have a quick recap on the functions of the kidney. A good mnemonic to remember this is a wet bed. And that represents A for acid-base balance, W for water balance, E for electrolyte balance, T for toxin removal, B for blood pressure control, and E for erythropoietin production, which is our endocrine signaling molecule that stimulates increased production of red blood cells. Then we have D for vitamin D activation. So moving on to glomerular filtration. So what is the glomerulus and what does it do? So the glomerulus is a network of capillaries designed with openings that allow for filtration. Think of this as a sieve. And the glomerulus is located within the Bowman's capsule. Think of this as the collection disc or dish of the sieve. And basically whatever falls out of the glomerulus enters the Bowman's capsule. However, we don't want all the blood in our body to exit through the glomerulus, and thus, as such, only 20% of the fluid that flows through this network of capillaries is actually filtered, whilst the rest of it continues on into the body to be recirculated. But after many cycles of this, all of the blood is filtered in our body via this process. A key thing to remember is that blood enters the glomerulus via afferent arterioles and exits via efferent arterioles. Good way to remember this is E for exit. So the glomerular filtration rate represents the volume of plasma filtered from the glomerulus into the Bowman's space per given unit of time. And a normal GFR in a patient is about 120 to 180 mils per minute, depending on anatomical variations due to some people or some patients having more nephrons compared to others. This equates to about 172 liters per day. And as we know, we don't use the bathroom enough, nor do we have enough volume of liquid in our body for 172 liters to be excreted every day. Therefore, most of it is reabsorbed back into the body and recirculated. Due to the variation of GFR in normal patients, in the hospital, we determined that a GFR has to be greater than 90 mils to be considered normal. Quickly, for some terminology for the next few slides, is that reabsorption equals the movement of substances and fluids from the tubular fluid to the blood, while secretion is movement of substances and fluids from the blood to the tubular fluid. And this, however, is in reference to peritubular capillaries and not stuff that is filtered out via the glomerulus. Really filtered means concentrations in the Bowman's space or outfiltrate of a substance is equal to the concentration in the plasma. Therefore, the filter doesn't actually prevent it from exiting the blood into our Bowman's space. Clearance means how much plasma needs to be filtered to give the amount of substance secreted in urine, whilst excretion means what leaves the bladder. Factors affecting glomerular filtration rate can basically be boiled down into factors that affect hydrostatic pressure. Because if you have increased pressure or increased fluid entering our sieve, we're going to have increased fluid exiting the sieve, therefore increased GFR, and vice versa. Therefore, a decrease in capillary hydrostatic pressure will lead to decreased glomerular filtration rate, whilst increased capillary hydrostatic pressure will lead to increased glomerular filtration rate. And these can be attenuated by changes to prostaglandins as well as angiotensin II, which act to dilate afferent arterioles or constrict efferent arterioles, respectively. And we know we have certain drugs or medications that act on prostaglandins and angiotensin II, known as our NSAIDs and our ACE and ARBs. Therefore, these things can alter the glomerular filtration rate. Next, we have creatinine clearance. So, GFR or glomerular filtration rate is a direct measurement of the kidney's health. However, getting this value or calculating this is really difficult, as you'd need to have a substance that you can measure as it's excreted through the body compared to the amount that is present in the plasma. This is quite cumbersome and hard to do with all patients. Therefore, we utilize creatinine to estimate this value. Creatinine is produced by muscles at a constant rate. It is cleared renally at a constant rate, and therefore can be used to estimate our glomerular filtration rate. However, graphs onto a exponential decay graph, and because of the sharpness of this graph, 50% of the renal function is required to be lost before we see a notable change in our creatinine. And at that point, a lot of kidney damage has already occurred. Therefore, we utilize direct measurements of GFR in patients who have suspected kidney function, as it's more useful to identify these patients, as we can see small changes more rapidly and more effectively. In terms of clearance and filtration equations, for a molecule that's freely filtered and not reabsorbed nor secreted, the GFR is equal to the urine flow rate times the freely filtered concentration in urine divided by our freely filtered concentration in plasma. For a molecule that is not freely filled, clearance equals to the urine flow rate times the compound concentration in urine divided by the compound concentration in plasma. So what do these actually mean when we compare them to each other? Well, when clearance equals to our glomerular filtration rate, then the compound is freely filtered. If clearance is less than our glomerular filtration rate, there is net reabsorption of the compound into our peritubular capillaries, and vice versa. When clearance is greater than GFR, then there is a net secretion of the compound into the tubules, renal tubules, from the peritubular capillaries. What's useful about these equations is the fact that we can't directly measure GFR, as we don't have access to the fluid that is released out of our glomerulus into the Bowman's capsule of every nephron in the body. However, if we could find a certain molecule that leaves the glomerulus at a certain rate and is not reabsorbed nor secreted, therefore the amount that is excreted or cleared out of the body will be equivalent to GFR, and therefore we can use these values to equate it and measure GFR directly.